nobody's ovaries are sewed into their gastrointestinal tract. So if we swallow the estrogen and progesterone and testosterone, it's acting as if our ovaries are right here in our guts going with the hormones going straight to the liver. No, that's not the way nature does it. In fact, there's research that shows that even if we use the safest estrogen called Estriol, if it's swallowed, it causes some endometrial problems. Not severe ones, but it does. But if it's used as close to the way that nature does it, it doesn't cause any problems at all. Yeah. So where are ovaries? They're in the pelvis. And from the pelvis, or from the ovaries, excuse me, the blood drains from the ovaries into the pelvis, goes up a big old vein to the heart pumps the estrogen all around the body, and then it returns back to the heart and lungs, and then it goes over to the liver where it's finally detoxified. But it certainly doesn't go to the liver first, where it would go if we swallowed the stuff, which unfortunately is what's promoted in that very well-selling book by the Hollywood actress. Okay, so we try to copy nature. And we have the pharmacist put together the molecules of estrogens that are precisely identical to human, remember that, and in the same proportions into a what's called transdermal cream. It sounds like across the skin. Well, we don't have people rub it into the skin anymore because, gee, nobody's estrogen comes in through the skin either, does it? It comes from inside. So what we found is that women who rub it into the skin usually get away with that for a few years, and then it just quits working for many women. So now our Women's Health Department has everybody rub their, this is women now of course, rub the hormones either into the vaginal area or inside the labia, which takes the hormone right into the same veins that the ovaries put it into. And that's what we want, because that's what nature does. It goes right into the same veins that the ovaries put it into, circulates in the usual way, detoxified in the usual way, and that apparently is safest. And the same thing goes for any other hormone that's made by the ovaries. It's rubbed into the area that brings it into the veins, that circulates it around the body properly. In fact, that principle is used for male hormones too. We don't have people swallow them or rub them into the skin. They're rubbed into the areas that drain to the pelvic veins. That's where testicles drain to, and that's either the scrotal skin, or which is very sensitive to testosterone, or if that doesn't work, and it doesn't for the occasional guy, we have to have him use it on the anal rectal area, because that drains into the pelvic area too. So we want these hormones to follow their route that nature designed for them. It seems almost dogmatic. Let's copy nature all the time. But geez, that's why we're all here, because nature did it that way. And when we deviate from that, and a researcher gets around to studying it, we usually find out it causes some small to large problem if we deviate from the way that nature did.